Your question?
Speaker, and back to the Premier. The stats don't mean anything. If you're a mother waiting for a 5-year-old for 3 years, having to wait 3 years for surgery is causing other medical problems for Zoe. And Danielle, her mother, says Zoe is gaining weight at an alarming speed due to her inability to walk, Speaker. It's causing worry of diabetes. And Zoe's been waiting for far too long already, and she continues to be bumped farther and farther back. Speaker, what 8-year-old girl do you know that is wishing for knee surgery? Zoe does, every single day for the last 3 years. My question, Speaker, when will the Premier finally admit that his government is failing to properly address wait times and surgery backlogs in our healthcare system?
Member for Eglinton Lawrence.
Thank you, Speaker. As I said before, we know that the volumes in our ICUs in pediatric hospitals are high, and we're continuing to mobilize resources to meet critical needs of very ill patients. The Premier, myself, and others were at CHEO just recently to look at the children's treatment centres there and to meet with some of the providers to learn more about the needs of CHEO and other pediatric hospitals. But as I said before, we've provided $4.6 million more in funding for those hospitals to add an additional 9 acute care beds at CHEO and 10 acute care beds and 3 ICU beds at Sick Kids Hospital. And our government, as we work on addressing short-term stressors on the system, continues to advance meaningful reforms to build a more resilient, patient-centred and integrated system. And we really want to make sure that patients like Zoe do not have to wait in the future. Thank you.